The Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala, and this is Thomas Benarott. Tom is a personal injury attorney who knows a great deal about people who are involved in personal injuries, and this is the first of a two-part series dealing with the effects of automobile accidents, and Tom has a great deal of expertise to share with us in that matter, and so we're going to call this the risk you face when you're involved in a personal injury, automobile accident, any kind of an accident that could cause trauma to your body. So, Tom, I understand you're going to start with a video of a car accident.
We are. We're going to start with a video showing
You're going to explain that then?
I'll do my best.
Good.
This is a rear end impact, and what it is we're going to show two different speeds. The first is a 4-mile-an-hour impact, and what it shows is that with the impact, because of the force generated by the automobile itself, that the impact of the body is greater. And as you can see, the body is lifted, the head hits the headrest at a point higher, which we'll talk about how that impacts later. Certainly a significant thrust to the neck, glasses fly off. As we continue to play it, you'll see it in slower motion. Body lifts, head goes up. You can see by where the headrest hits that the effect that has on the neck, and frankly the low back as well, because as that impact occurs, the low back is arched, which makes the head go up, hit higher, and therefore causes greater impact on the neck and greater injury to the cervical spine and soft tissues.
I know in a lot of the, as they continue to run the video on a lot of the x-rays, new patients that we see, they'll be complaining of shoulder problems as well. And a lot of times if they do go to the hospital or some medical clinic or chiropractic clinic, they aren't thorough in the evaluation, and if they do x-rays, very often they don't x-ray the shoulder. And many times when you do, you find that there's an acromioclavicular separation. And the only way you can truly determine that, of course, is on x-ray.
Right.
And so there's not only the possibility of neck injuries, but injuries to the thoracic spine, mid-back, and like the lumbar spine that you said. So it's a significant importance of thoroughness again, isn't it?
Absolutely. Mm-hmm. And the only way to preserve the information is to know what you need to obtain and know how to do it.
And it's interesting that there are, I think that the attorneys know more about who the good personal injury doctors are, and as well as who the, I wouldn't want to use the word bad, but less thorough doctors who treat or examine people involved in personal injuries. There are some who are really good at it. They really know what they're doing and take their patients seriously as if it was their own wife or their own husband or their own son or daughter or something like that.
Absolutely. Yeah, and from an attorney's perspective, obviously any case you get, if you're a trial attorney, what you always think about is you see yourself on day one and plan for what would happen if I have to go in the courtroom and take this case to trial. The only way you can really do that effectively is if information is procured early, not only to try to help the person get better, but from my perspective, I have to think about what do I need in order to advance their legal case too and help them best to represent them.
And if the doctor does his or her job, then it goes in a perfect segue or blends in well for what the attorney needs to represent the client adequately, right?
Absolutely.
So thoroughness, if it's not at the beginning, you can't make it over. It's like getting a bird kink. There's not much you can do with it once it comes in.
Yep, you got to have a baseline.
Well, do you have anything, do you want to run that video again, or have you covered everything that you thought was necessary?
Well, we're going to run it again in the second segment. I know we have another speed too. You could run the second speed if you wanted, just, I guess, for sake of showing what happens with a little bit harder impact to show how this, I guess, incrementally how the speed goes up. I think the most telling thing there, at least to me when I watch that is, I guess most of us think of a 4-mile-an-hour impact as not, you wouldn't expect it necessarily to do what it did to the body there. And then again, when you view the rear end of the car, visibly you don't see anything. Up underneath the car, certainly I'm sure there would be damage there, and probably even in the rear bumper, inside the bumper itself, there's normally a cushioning pad in there. A lot of times that will cause that either to break up and or to more or less just crumble. This is the little faster speed, and this one too, again, I think it just shows the severity of, if you look at the glasses and compare that with what we saw before.
And his head seems to be turned somewhat to the right too, doesn't it? So then the likelihood of causing more injury to the right side of the cervical spine would be logical, I would assume.
Right, yep, the positioning of the body certainly.
And did you bring up the issue about the headrest, that it doesn't fit his head correctly?
Yeah, we talked about that
You
a little
did,
bit. Well,
okay.
I alluded to it, but yeah, I mean,
pretty
it might even be fine as he sits there, but the problem is once he gets hit, it makes him sit up straighter, makes the lumbar arch, and once he does, then it doesn't necessarily protect him like it would otherwise.
Well, what are some of the risks of acute injury that you've noticed to be most common?
Right, well, there's a number. One of them is a greater incidence in females, sometimes just a difference in size between males and females. Females are at greater risk for injury. People that have a history of neck and back injuries, whether it be from a car crash or something else, are also at additional risk just simply by nature of the fact that, and you could probably speak better to even what happens, you're more susceptible when you've been hurt once, and even interestingly, some of the insurance companies use computer programs nowadays with the advent of computers and programs to try to figure out what cases are worth. Many of those programs will even give an additional value to a case by nature of the fact that somebody's been in a collision before, because there's a greater susceptibility to injury from a prior injury.
Well, is it then, would the software in those computer programs be inclined to be in the favor of coming up with lower estimates of what the case is worth then, being that it's the insurance company? Or
Yeah, well, the goal is I think, at least if I argued the insurance side, it would be to try to get symmetry, probably allow everybody to kind of value the similar injury with a similar value. The thing it doesn't take into account certainly is that everybody's different. Everybody has different things in their life that they could do before that they couldn't do after, which is the intangible. But yeah, I mean, the goal is certainly to, I guess, out of fairness to the insurance companies, try to kind of have a kind of a baseline number. But yeah, it's always to make sure that people aren't overpaying on claims.
then does it mean that if this person who was involved in a motor vehicle collision and they had prior back problems, maybe had been under medical or chiropractic care, or maybe no health care whatsoever for the back problems, that the car accident really didn't cause any trouble, that they are the guilty ones, not the person that hit them?
Oftentimes that'll be the argument. The argument is if you had prior problems, the insurance argument is, well, that's certainly got to be the cause of the current problems, not your current situation. So that is an issue that we often face, both as a practitioner and as a legal representative.
I think that's, in my experience of being involved in this aspect of practice for 40-some years, is that obtaining an adequate prior medical history is important. And if they've had problems, fine, but what were they feeling like at the time of the accident, and what are they feeling like right after the accident, days or weeks after the accident?
Absolutely. That goes back to your thoroughness too, and that goes back to as a practitioner documenting what happens, symptoms, what they are from visit to visit, improvements from visit to visit, what affects them from visit to visit. All those things are, greatly important to trying to establish, whether it's the crash or other things that are causing their problems.
How about any other risk factors that are prominent in your mind?
Well, we already talked a little bit about the headrest, or the headrest, and where it's positioned. Sometimes that's dictated by the age of the vehicle, those sorts of things, type of vehicle maybe. Sometimes it's even just the type of restraint, whether it's a lap and or a shoulder belt, if you have it on correctly, if it fits the person properly, that can certainly have an effect.
Does it mean if the automobile has airbags and they don't go off, that it wasn't a significant collision then, and their airbags don't go off, that they shouldn't have any injuries?
Not at all. And I don't know all the intricacies. I know oftentimes, a side impact, and depending on whether you have side airbags, it isn't going to necessarily cause the front airbag to go off. Sometimes a rear impact. I just had a case where a couple gentlemen were rear-ended by a truck that was pulling about 20,000 pounds of broken up concrete. Certainly the impact there was enough to normally cause the airbag to go off, and it didn't. So, many things can come into play. But yeah, I mean, and the airbag itself can be a cause of injury if, like the video, as the head's going back, if you're coming back forward and then the airbag hits you and pushes the neck back, and all those things play in.
Do you see many people who were children have been in the car that the children begin to complain of pain? Some of these kids can't even articulate pain yet other than to cry.
Right.
And many times a parent doesn't know that maybe they're injured. So is that true that children could also be injured?
Absolutely. In fact, in the vehicle or the incident I just referenced, there was an 11-year-old child, which a little older, kind of in that in-between stage. But yeah, he was visibly hurt, but had a hard time articulating, what exactly was going on. But even littler kids, they can kind of point, and I always am of the mindset, even though insurance companies, they use the children's bounce back quicker, which is true, but they kind of think they can't be hurt, but that clearly isn't the case.
Well, if that was a true statement, then why is the St. Paul Minneapolis Children's Hospital so filled with children
That's right.
that don't bounce back too quick?
Right.
And I know you brought along a couple X-rays, a before and after X-ray of a child who was healthy before a car accident. Maybe they want to bring those up so we can take a look at
absolutely.
those.
That would be great.
So the one that we see there is the before, and of course that's an X-ray of a child, right?
Correct.
And it's quite a significant curve there. That would be almost like a C curve that was reversed. And children have muscles and ligaments and tendons and bones, and they're much softer. For example, a little child like that, those bones aren't even ossified, so the growth centers are very, very soft. And so like any other human being, the body's going to go into spasm when something's hurt. It's kind of a mechanical cast. And if it's not looked at correctly and soon and properly and very thoroughly, they're going to grow up with a curve. And then maybe later on in life begin to have back trouble.
Absolutely.
So in this case, this was a child who happened to go to a very thorough doctor chiropractic who, after a short period of time, we can bring up the other X-ray then, and we'll see that spine straightened out very, very nicely. And that's the way it should. Now, that doesn't mean that's always going to happen, but that's the goal, so that this child can grow up healthy and straight. There's a statement that says, as the twig is bent, so grows the child. And we think about putting a bent tree in the ground and putting a stake on it to try and make it grow straight. So you're of the opinion, when you deal with thorough physicians, that they examine the children as well, even if the kids aren't having any trouble?
Absolutely. And here it's the best example, and I think your example with the tree makes perfect, it's a perfect analogy. The smaller the tree, the easier it is to bring it back, but the faster you correct it, the more susceptible they are going to be to getting better too. I think this was, I believe, if memory serves me correctly, 8-year-old child in this
That's
case,
right. Mm-hmm.
and approximately eight visits allowed the curve to be corrected back to where it was supposed to be.
Yeah, it was a pretty good doctor and a very lucky doctor.
Well, but again, early recognition, and in this case, I mean, the good part too is we actually have the before and after. So
somebody had the intelligence to take it before,
right?
And to follow it up rather than go to some chiropractor who's going to crack them in the back, or something like that.
Well, in this case too, I suspect that if the initial film, for sake of argument, even though it should have been done, if it wouldn't have been done, you're still going to be able to palpate the difference. But I think it still speaks volumes, and you have the reassurance when you can compare and show mom or dad, they're going to have to feel awfully good about what happened and that they were smart enough to take the child in to be seen.
And sometimes, and justifiably, parents are really concerned about radiation to their children, and that's a justifiable concern. But again, there isn't anything that's going to show us something more clearly than an X-ray or an MRI or a CT scan. You can use all kinds of instruments and semi-scientific instruments that make it look okay or make it look bad, but there's nothing more scientific to show objective problems or not than an X-ray.
And again, just from the legal perspective too, a picture's worth 1,000 words. We've all heard that before, but I mean, I don't think anybody's going to be able to, if you show this to a jury, not understand how there was an injury to this child, and again, show also the benefit that the chiropractic care provided to repair the problem.
Right. What are some other risks that you're well aware of?
Well, the position of the individual within the automobile, okay, and that can be dictated.
So passenger, driver.
Right.
front seat, back seat.
And even then, sometimes the position of the impact as well, depending on where you're positioned in the car, how you're hit, the way the force goes. A hit on the corner will push you in a different direction as a hit from the rear, a hit from the front, a direct impact right into you. It can cause different things. It can cause you may hit your head in a certain way if you're the driver and you get hit from the side, you're more apt to hit your head on the window or the headrest or the visor or the mirror, and head injuries or whatever can develop as a result.
I know all of the doctors that attend our risk management seminars, we go through these things with these doctors and say, please address these questions in your entrance case history.
Yeah, and a lot of them, you seem that they're kind of common sense, but again, when we do things day to day, you can either get in a good habit like you do, where you have kind of a program that really well sets out and helps you walk through everything and accurately document it, or you can get in the bad habit like many practitioners unfortunately do, where they don't really have that guideline. And unless you do it every day and you keep going through it, then it becomes second nature. If not, there's things that you miss that once missed, you never are able to really recoup. Because when you try to bring them up later, the insurance companies always see it as a kind of a back-end way to fix the problem instead of a proactive way to try to help people get better, and at the same time help me as the attorney to try to represent them and have the information there that's vital to their case.
And I know seminars that I've taught for medical specialty clinics as well as risk management seminar for chiropractic physicians is that there is a vast difference between general practitioners and practitioners that would be oriented to motor vehicle collisions.
Absolutely.
Or workers' comp injuries or malpractice, for example.
Yeah.
If you don't deal with malpractice or once in a while, or if you don't have a large aspect of your practice that's dealing with motor collision victims, you're jumping around. It's like playing dermatology and gynecology and obstetrics and then, rheumatology, so it becomes very specific. And of course, thoroughness again is the answer.
Right.
Sometimes people will say to me, well, I can go to this chiropractor over there, he's close to my home, or I can go to her over there, or I can go to this medical clinic over there. And then in my case, as you know, I see a lot of people for second opinions and sometimes third opinions from attorneys and wanting somebody to try and pull this case together and find out what's happened. And people find out too late that the doctor isn't that good. Just because I have a great personality doesn't make me a great doctor. But unfortunately, people judge us by our personalities unless a mistake is made. But Mayo Clinic or John Hopkins or Cleveland Clinic, or for example, your law firm, got there because they specialized. Because Mayo Clinic, and you were raised in southern Minnesota, why would anybody want to go down to that area for health care, to fly all over the world for health care? When in fact, and I've done work down there, not as a physician, but one of the research programs, they tried to determine why people go to Mayo Clinic when they could go to somebody in St. Paul or Minneapolis or Edina or Woodbury, whatever it is. And the only difference between the medical doctor here, say in the Twin Cities, and of course our program is watched all over the United States, but in the Twin Cities area here, is that when they go to Mayo Clinic, they have a much more thorough workup. Because Mayo Clinic does not contend that they are better than any other medical doctor in the same specialties. It's just that you're going to go down there for 2 or 3 days and somebody's going to examine you from stem to stern, and when up here, you're going to rush them through, particularly if it's a managed health care program, or even in the case of many personal injury practices where they're really running, I don't know, for lack of a better, a mill, where you kind of hang them on a hook like a piece of cattle and run them through. There's not thoroughness then.
Right. Well, and I think that, part of it is that you got to have the right plan in place to work from, like you do. Records are complete, thorough list of things you check. And what the byproduct that also should be, if I'm the patient coming to you, I'm probably more apt to get improvement as well because I know you're thorough. I'm going to feel more comfortable with you, feel more confident in you. The more confident I feel, at least from a psychological perspective, the better my growth, my improvement should be.
I've never thought of this question, but under Minnesota no fault, I know there's people in other states, so the law varies in that, but under no fault in Minnesota, if I was injured in an automobile collision and I went to a medical clinic or a chiropractic clinic or a physical therapist or massage therapist, and I wasn't pleased with the doctor or the therapist, or I wasn't it kind of looked to me that they were selling personality there rather than thoroughness, that there wasn't scientific accuracy there. Do I have a right that I could switch doctors?
Absolutely. Yeah, I mean, nobody can tell you where to get medical care, okay? People can make recommendations. Probably the best one, as we've talked about in other shows, is the personal recommendation. But yeah, the insurance company can't tell you where to go other than the one exam that we've talked about sometimes too, the independent medical exam. But you can get treatment wherever you want. And the most important thing I always tell my clients is, if you don't feel like you're getting good care and not getting better, look somewhere else.
Wonderful. How about does a person being aware, like looking in the rearview mirror, or if somebody's coming from the side and they catch them or they see them coming in the front, as you're experienced as a personal injury attorney, does that have any bearing?
Absolutely, and it could either be you see it coming, or maybe you don't see it coming, or you're impaired from alcohol where you're maybe more relaxed. I mean, it can be a good thing or a bad thing, and I think it depends probably on the circumstances. But a lot of times you'll hear that explanation. Did you see the impact coming? A question the insurance adjuster oftentimes asks when they take a recording statement early on in a case if there's no lawyer involved. And yeah, I mean, if they tense up and feel it coming, that can have more of a susceptibility to injure. Although it can be in some respects, it can be a good thing too if you're relaxed and don't know it's coming, maybe, so you don't tense up.
Now, you know what the term, and we always ask, we have a questionnaire on auto collision victims about cognitive dissonance. And so when you meet these people as new clients, is that something that's important to you, that the doctor's records have checked that out? Is their thinking clear? Are they remembering things clear?
Absolutely.
And do you think that has any possibility of permanent brain damage or trauma?
Absolutely. And you can probably speak more to the intricacies of close head injuries or post-concussive syndrome. But I think the mindset in the insurance companies, having been a former insurance adjuster, is the only way somebody can have an injury to the head is by striking the head, which, as you know, is not at all true. Depending, like even that example we saw before with the whiplash video, as the head snaps, certainly everything gets moved around. You can have bleeding and so forth that causes those sorts of problems. The hardest thing with cognitive dissonance is that, a lot of times as an attorney, you don't know people beforehand. Right. When they come to you, you don't know, is this the way they always are, or is this the way they are after the fact?
So then it goes back to the doctor's initial evaluation.
Absolutely. And even probably, tracking what happened on the initial visit and then the improvements and symptoms as time goes too, where you can see, if you see that improvement, you're able to tell, that there probably was a head injury of some sort right away, or, the inability to put A, B, C, and D together and kind of reason things out.
And it's been my experience, not personally, but professionally in risk management seminars, that a lot of chiropractic physicians and medical doctors, but mostly the chiropractors, very often do not send the medical bills in right away. They let those bills accumulate. And very often the patient doesn't seek legal advice quite soon after the collision. And so if that's the case, then does that kind of tie the attorney's hands? Because if he or she is going to look at those records, they have a pretty good idea based on the doctor's records if that doctor is thorough or not?
Absolutely. And it does a number of things too. I mean, you can make different arguments, but a lot of times the faster I can get involved in a case, the better. Because nowadays, even when police are called, every time they don't do a report, witnesses oftentimes are there and see the collision occur, but unless somebody grabs their name and their phone number, they disappear too. The byproduct of maybe not getting early involvement too is that vital information with respect to even who's at fault in a collision, because fortunately people aren't always honest after the fact, because their mind starts to think about insurance premiums and getting sued and whatever else that they're at fault. They deviate from the truth. The faster the attorney's involved, the quicker that information can be gained, and the faster that I can get involved to help them, get their bills submitted, look at the records, and try to work together with the practitioner to make sure they're getting good care.
Mm-hmm. What about endorphins? We've talked about that. We know that they're pain control chemicals, neurotransmitters they're called, and we know that even the bones have endorphin receptors. So in the acute injury, not everybody's got pain right away, or pain 2 or 3 days later, right?
Absolutely. I just had a case yesterday. We went to a no-fault arbitration with a young gal that got hit very hard with somebody that ran a stop sign. She had some pain right away, but when she went to the emergency room, they out and out told her, and the record said, you're going to get a lot more sore in about 2 days. She didn't have either a chiropractor that's knowledgeable, such as yourself at that point, and or a legal representative. She gave a statement to the insurance company approximately 36 hours later. She didn't have everything fully, set forth yet. But what happened as her body, the shock of everything and kind of the protective measures that were in place wore off, lots of things start to hurt that weren't when she went to the emergency room on the day of the incident, and even when she gave the statement to the insurance company 36 hours afterward. I think that time frame I often hear is kind of 24 to 72 hours, and even after that, as your body, and everybody's different, what gets me excited sometimes it may make me react one way, may impact you differently and somebody else, and as those things wear off, I'm going to feel a lot more than what I'd been feeling before they wore off.
And or the absence of symptoms does not necessarily indicate the internal presence of wellness.
Not at all, which is why it's vital to get those x-rays like you do.
Can an insurance company, let's say I'm involved in a motor vehicle collision, and I'm worried about my insurance premiums going up. Now, that's a justifiable concern in these days. Can an insurance company, let's say XYZ insurance company, say, we paid out X number of dollars, so we're going to raise that person's insurance? Can they go and do that? Is that legal to do that? Or?
Well, the answer is depends.
Depends.
Well, it depends probably on whether you're at fault and there's a number of different factors. But if I get rear-ended, if we're out on the road and you and I are driving along and somebody rear-ends us and we have to get medical attention, we go into our no-fault policy, they're not going to raise your premium, or they can't because of that. Certainly if you're at fault and you cause them to pay damages to somebody, then that's a little different scenario. But yeah, a very justifiable concern, and one that we all share in nowadays, because the last thing we all want is higher insurance rates.
Is it legal? Let's say that I have a patient that was injured in an automobile collision, and somehow they found your name, saw you on television, because you're on television a great deal, and they called you and you interviewed them and said, yes, I'll take your case, and so you send me a letter wanting copies of the records. And let's say that my records do not meet what you know to be current medical standards set by the Minnesota Board of Chiropractic Examiners, for example, and same standards that the Minnesota Medical Board sets for medical doctors. Is it legal for an attorney then to sit down with a client and say, based on the records that I see here, or the reputation that I've heard about Dr. Lala over the years, that maybe you should see an orthopedic surgeon or maybe another chiropractor or some other specialist?
Yeah, I think we all have different ways we do things, but certainly in that scenario, you would make that referral anyway. A lot of practitioners aren't as astute as you are. I always have an obligation to my client to try to get them the best medical care I can, both for purposes of helping them get better, helping their legal case so I can properly represent them. And yeah, if I see something in the record that doesn't fit, I might either talk with the practitioner and or my client and or both.
So again, it's important that quite soon after the motor vehicle collision that they call an attorney, tell them what's happened, and seek some legal advice right away.
The sooner the better.
The sooner the better. Well, we've enjoyed having you with us on this dimension of House Call. I'd invite you to call Mr. Benarat and talk to him. He's a good man. Also knows the Lord, too. So take good care of yourself now. We'll see you on our next show.